Hey everyone, so last but not least is one of my favorite people at this meeting. So we're at Veterinary Cancer Society meeting and we're with the ever awesome Dr. Chad Johannes. And one of the things I love about you, Chad, is you're super practical and you're always giving me great tips that I know I'm going to go home and use in practice. And there's this great drug that's now going to be available to veterinarians and for pet owners called Entyce. It's a new appetite stimulant. So if you could help our veterinarians out there and technicians and even pet owners, just tell them a little bit about the drug and what you want us to know, because you're probably one of the people with the most experience with this new great drug.
Yeah, I think we're at a really exciting time in not only just veterinary oncology, but veterinary medicine. It's rare that we get an opportunity to bring a drug that may really change how we're able to manage our patients and really quality of life affect our patients. And so inappetence, decreased appetite is something we so commonly see in our patients, and it's really impactful on quality of life.
I mean, I've had pet owners, you know, if the pet is still not feeling well from the treatment before, they may not want to treat, they may not want to come in. Or they're only eating chicken, you know, they won't eat their regular food, and it's really stressful. And I went through it with my own kitty with lymphoma, and I think I was begging you for this drug a little bit. I was like, can I get some, please? So it's super stressful as a pet owner to not see your pet eat.
Yeah, and we've really struggled in not having reliable, effective therapies. We have things we try, but it's kind of like a side effect of the drug that may or may not trigger appetite in those patients. So now we have, you know, an FDA-approved appetite stimulant for dogs that is in a category of drug that there's still no approval on the human side for that. So that category of drug is in several phase 3 human trials. But
that's super exciting.
Yeah,
we're ahead of the 8 ball, right?
Yeah, we're ahead of the 8 ball, and so being able to have that and, you know, kind of being able to learn how to utilize it best for our patients, I think is really exciting.
So a couple of questions. It can be used chronically.
Yes, and so one of the key things about this drug is it has a 12-month safety study in healthy dogs, and with that, the FDA gave it an open label. So
that's great.
While the efficacy study was 4 days, there's an open label, and so I think, you know, the internist oncologist in me has a lot of ideas on ways for chronic patients that we can use that for quality of life, and there's so many benefits to feeding and to feeding through the gut and maybe avoiding feeding tubes in some of these critically ill patients, those kind of things. There's a lot of, I think, potential advantages.
So one of the questions that I have received, because I was telling a lot of veterinarians about this drug, is what about cats? And one of my nurses always feels like cats, and I just mentioned this earlier, the second-class citizens in veterinary oncology. So I know it's not labeled for cats, and so, you know, so you need, and we as veterinarians have to tell pet owners that if we're using something off-label, but are there studies in the works, or what can you tell us about using it in cats?
Yeah, so a good point. It is off-label use. The advantage we have as veterinarians is, you know, we have the potential to use that off-label. There is actually just a study published this week looking at using capamarenil, the drug, in cats for 91 days. So it is a drug that we will be some learning, but I will be using it likely in cats out of the gate. How the drug works, it also increases growth hormone and IGF-1 levels, so we do have to keep an eye on especially diabetic patients, or patients that may be, like especially cats who get type 2 diabetes and may be prone to becoming diabetic. We don't know if the increase in growth hormone and IGF-1 levels may make them more prone to becoming diabetic or be more difficult to regulate in their diabetes. But
so one thing that I always talk about with cat owners with lymphoma is chronic steroids can lead to diabetes. And if I've made a couple of cats diabetics, and that was... So that will be something that we should be thinking about if we have cats on chronic steroids. I wonder if that will be something that we see kind of play out.
It's important to, you know, all the negative feedback loops that need to be in place to keep those growth hormone level and IGF-1 levels in check are still in place. So it's not like we're going to make them macromegalic.
Right.
We're going to bump up their IGF-1 levels above baseline, which gives us a lot of the increased muscle mass and those anti-cachexia type things we see in patients with chronic kidney disease, cancer, etc. We don't know yet whether or not that slight bump is going to affect insulin control. So a lot to learn. and a lot of things to be vigilant in as you get a drug that's been in a few hundred patients into several thousand patients. But
no, I mean, I think it's a learning curve, and we've seen that we're lucky. I feel we have had a couple of good drugs come on the market, but it's definitely a learning curve. I mean, Serenia, for example, when that first came on the market, we were only using it was labeled for 4 days, you know, or 5 days. I used to do, you know, tell people 5 days on, 2 days off, but then there were additional studies that said you can use it chronically. So, you know, with the injectable one, it was sub-Q, then we could use it IV. So I think we're at the cusp of really, you know, learning more about these drugs.
Absolutely. That's a great parallel. That's what I'll be talking about tomorrow morning is, you know, having been, you know, part of the Serenia launch as well, it's there's a lot of parallels, and there's so many ways that we've learned to use Serenia as an antiemetic in the last 10 years, you know, and so it's exciting to think in 5 to 10 years with capromorelin and that category of drug available to us, where we'll be using it. And it's interesting, so this drug is it's a ghrelin agonist, so it mimics the kind of the natural hunger hormone in the body.
And that's really cool, because this is the first drug that does that. Like, I mean, you I just really want to emphasize that it's like first, what do they say, first of class. I mean, really, really exciting. We have a new drug, new mechanism of action, which we will hopefully complement some of the other things we have.
Yeah, and when you look at the human literature, there's so many things that ghrelin does in the body. You know, appetite stimulation is one of the key ones, growth hormone increases. There's anti-inflammatory and all these other things that may be beneficial, so that's where it's exciting how we may, you know, ultimately learn how to best utilize this drug in dogs. And you know, Aratana, the company that's launching Entyce or capromorelin, is also currently evaluating it in cats. So hopefully, you know, if that study shows you know, benefit, we may have an FDA label in cats down the road as well.
Yeah. So any veterinarians, if you're out there, I'm going to be doing some lectures in the upcoming end of this year and the beginning of the year, and he is the expert. So if you were lucky enough to catch Dr. Johannes at one of the conferences, definitely do that, because he's the guru of this, and you've taught me so much. And then you mentioned it, but from a practical standpoint, veterinarians out there, if you're looking like, how do I get this drug? It's made from Aratana, so definitely get on their website and you can find your local rep and then figure out how to order it. And it, you know, this is now the end of October, beginning of November, and you should be able to order it in the upcoming weeks.
Absolutely, yep. I think they're shipping next week. So.
Yeah. Oh, and we're doing a really cool lecture on mast cell tumors in January at VMX.
Yep.
The night after Rob Thomas performed, so I may be a little bit tired. I'm just saying, they had a whole conference and they put his thing. So anyway, I'm friends with him.
Yep.
So we're going to have a lot of fun. So join us there.
You can be backstage, huh?
Yeah, well, we'll be like side stage. Anyway, so check out Dr. Johannes. Check us out at VMX. Everybody, thanks for joining. Thank you for teaching me so much.
Absolutely. Thanks for having me.
Thanks.
Bye.
Bye.